Hello, I am Dr. Subramaniam. I am a senior consultant urologist, transplant surgeon and a robotic surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Kidney stones are very common, but there are a lot of myths and facts surrounding kidney stones. Today we are going to bust some of those myths and find out what is the truth and what is the reality with regards to kidney stones. This is a myth. Not all kidney stones are painful. Only stones which produce a blockage to the flow of urine from the kidney, that is stones which are blocking the tube coming from the kidney, which is called the ureter, or stones which are sitting in the pelvis, which can produce pain. But there are a lot of times we see a small stones within the corner of the kidney, and these are not painful. So this is a myth. This is true. Kidney stones are more prevalent in men. We see a lot more men coming with kidney stones compared to women. Having said that, it's not that it is very rare in women. We also see a significant number of women coming back with kidney stones, but definitely a bit more common in men. This is a myth. Not all kidney stones require surgery. A lot of times we see stones which are small, 2 to 3 millimeters, which are sitting in the corner of the kidney, or maybe even smaller stones which are in the ureter, which is the tube coming from the kidney. These stones don't require surgery. Some of these stones pass spontaneously. Some of these stones remain in the kidney for forever without producing either pain, without producing any damage to the kidney. So not all kidney stones require surgery. Only stones which are symptomatic, which produce pain, discomfort, or which can damage the function of the kidney, though these stones require surgery. Oh. This I think is a myth. There is a lot of hype about cranberry juice and a lot of dietary supplements with regards to kidney stones. There is no scientific proof to say cranberry juice can produce relief from kidney stones. But again, a lot of things are in the community which are very difficult to scientifically explain. But people do believe that cranberry juice can be a treatment for kidney stones, but there is no scientific proof for that. This is again a myth, because kidney stones produce pain only when there is a blockage to the flow of the urine from the kidney, and there is an increased pressure within the kidney. This happens when the kidney is functioning very well, and also when urine stays in the tube, which is the ureter, above the level of the kidney stone. And stones don't produce pain all the time. You can get stones producing pain for a couple of days, 2-3 days or a week, and then remain silent for a week or 10 days and come back with pain. So it's not that the fact that the patient doesn't have pain doesn't mean that the stone has passed. This I think is a myth. There is a lot of dietary fats which have been attributed to kidney stone formation. One of them is coffee, but again there is no scientific proof that coffee increases the chances of kidney stones, and we don't advise our patients to stop drinking coffee for preventing kidney stones. This probably is true, because when we talk of kidney stones, we see different types of kidney stones. One of these stones is called an oxalate stone, which is a very common stone, and we know that tomatoes have got an increased amount of oxalate. So in general we tell them to reduce their oxalate content in the diet, and particularly this set of patients who have what we call calcium oxalate stones. So patients with calcium oxalate stones, probably it's not a bad idea to reduce the intake of tomatoes which have an increased amount of oxalate in them, so that they don't form repeated kidney stones. This again is a myth. The diet depends upon the type of the stone they have. Majority of the stones which we see are either calcium oxalate or calcium phosphate stones. For these people we will tell them a specific amount of diet. But we do see a lot of other stones which are like uric acid stones, which form because of a lot of animal protein being taken. We get some cysteine stones. So to some extent the diet is modified depending upon the type of the stone which we see. In general, as a broad agreement, all stones require a large amount of fluid intake. So that part of it is same for all kidney stones, but specific diet requirements do change from type of the stone which the patient has got. This is true. The simplest way to understand this is that the kidney stones are not really stones. These are crystals. They form in water with related to the solute. So if you go back to chemistry and find out about solvent and solute, if the amount of water is less and the amount of calcium and oxalate in the urine is more, it forms crystals. and if you extend that, if the amount of water in the urine is more and the amount of calcium and oxalate is less, the crystal formation is less. So, in general, a large amount of fluid intake, any type of fluid, would probably help in preventing kidney stone formation. Today we busted some myths and about kidney stones. There are a lot of facts which are true, some of them are myths which do not carry any scientific evidence, and it is very important to understand these myths with regards to kidney stones. The most important message to everybody, every patient with kidney stones, is to drink a lot of water. It is always important to keep the water intake to at least 3 to 4 liters per day, so that the patients do not come back with repeated kidney stones. So, a patient who has got a kidney stone has always a tendency to form another stone, and data shows that if the water intake is not increased, the chance of a patient getting a recurrent kidney stone is about 40% in the next 5 years. So, this we need to emphasize to the patients, that the most important thing to prevent kidney stones is increasing the water intake.